Hello and a warm welcome to the CNBC Africa special, where we're coming to you live from the sidelines of the World Economic Forum. Now, joining us here today for a very critical conversation are key members and stakeholders of the healthcare fraternity. Now, this is because, as we know, one of the Sustainable Development Goals for the year 2030 is to achieve universal healthcare. But what methods are we using in order to get there? And how do we ensure that we leverage off of technology, innovation, as well as the participation of key stakeholders in order to drive this particular goal? Do stay with us over the next hour as we engage in a one-on-one conversation with the Minister of Health in the Republic of South Africa, and thereafter speak to a variety of key stakeholders within the healthcare vicinity to get their views on this critical issue. We're also joined here by a wonderful audience made up of various participants in the healthcare fraternity, as well as interested parties and stakeholders who will also be sharing their views in a question and answer session. We strongly encourage you at home to continue tweeting and sharing your feedback with us as to how you respond and have questions and feedback for key stakeholders that we'll be speaking to today. The official hashtag to use is Future Health, and of course do keep the account names at Philips South Africa and of course at CNBC Africa included in your posts. Without further ado, I'd like to warmly introduce the Minister of Health in the Republic of South Africa, Minister Zweli Mkhize, to the audience. Thank you so much for your time today, sir.
Thank you very much, and good afternoon to you and to all the viewers and the members of the audience.
Minister, this is a conversation that we've been looking forward to hosting, as you can imagine, given the dynamics of what's unfolding in South Africa's healthcare fraternity at this time. The NHI, the National Health Insurance, which is quite a buzzword within the South African healthcare fraternity. And just a week ago, you were not too far from this venue where we're situated, responding to questions from your peers in Parliament and really giving them an understanding that South Africa cannot not afford to implement the NHI. There's been a lot of criticism about the financial burden that this comes with. How do you respond as we look to clear the muddied waters regarding this issue?
Well, firstly, let me say that it's an exciting time. Indeed, we've actually been looking forward to this moment for a long time. We have been health activists for many of our years since we were youth. We've been actually advocating for this national health insurance to be instituted. It's about solidarity, social solidarity, where South Africans who are well-to-do are able to contribute, and the health services will become available to those who are less advantaged. And it's a worldwide global phenomenon now. Many countries in the West and in the East, and most of the governments are actually saying, South Africa, you've delayed too much on this matter. A few weeks ago, we were at G20, and the president of our country was invited together with the Minister of Finance, and the issue was South Africa was holding you back. And WHO is looking at the same matter. The whole of Africa as a continent, we're supposed to move on with universal health coverage. So our approach there is national health insurance. Basically, we're looking at a kind of a fund that gets pulled together with public and private contributions from individuals, from employers, from whatever sources, to create a fund that will then be the purchaser of the services. And this, as we do, is about bringing up the equality that South Africa is one of the most unequal societies in the whole world. And there are many studies that have been done that have indicated that the morbidity, the mortality rates are actually a major cause of a decline or a delay the growth of the GDP. There's also been a study that's been done through WHO in the continent to actually say that part of what is holding back economic development is the huge burden of diseases, and amongst the major contributors to that are 5 countries. Amongst them is South Africa, DRC, Nigeria, and so on. About 5 of them, they're contributing to 50% of the mortality and morbidity in the whole continent. And therefore, South Africa can't afford to wait any longer. For most of the countries, it has actually been clearly established that they started their national health insurance system when they were much worse than where they are today. Certainly, some of them were much poorer than what South Africa is today. Japan gave us an example of how a few years after the war they started, and 50 years later, they're not looking back. And many countries, Britain, same thing, Yesterday, 2 days ago, were the former Prime Minister of Norway, former Director General of WHO. Norway started an NHI following on Britain, basically a few years after the war. So everybody started when they're in a very difficult situation. So we're saying South Africa can't afford to delay, and you don't need a better economic situation. It actually contributes to economic development and a healthier population.
Minister, in order to drive and come back to the topic at hand, which is ensuring that we see strategic investment as well as innovation to encourage sustainable healthcare development, sustainability certainly needs finances, but it also needs healthcare professionals and practitioners. What is South Africa's government doing with regard to the skills base and the human capital that will be required to actually roll out sustainable universal healthcare coverage?
Well, there are two areas that we must look at. The first area is the general professional skills. That is all the different professionals, your physiotherapists, your nurses, your doctors, and occupational therapists. All of those particular skills that South Africa is capable of producing for ourselves. And I think what we need to be able to do, we've actually commissioned a team to revise our human resource requirements so that from now on going forward, they should be able to tell us in terms of where we are, size of the population and the needs of various diseases that we have to deal with and the nature of the system that we're running, what kind of spread of various categories of professionals, and therefore the country must be able to undertake to build that kind of capacity. The country is capable of doing that, of course. I think we just need a bit more focus because over the years we've actually had a bit of imbalance in the way this training was approached. That's why, for example, you found that we had to take students to Cuba because within ourselves as South Africans, we didn't quite agree as to what needs to be done and where do we get the students from and all of that. But I think that we've got a very different view at this moment. The second aspect is that there's a huge collaboration now with the heads of academic institutions, the deans of various faculties in the medical training field, all of whom have actually said to us that we need to put out there what are the requirements, and if government is prepared to back it up, they are prepared to work with us. In addition, we're sending a number of people out to various countries, 5 countries, in the next few weeks to go and learn about national health insurance in Thailand, in France, in the UK, in Turkey, etc. And the academic institutions have said, no, they're also going to add their own academics to go into the same countries so they can partner with the academic institutions there to come back and ensure that we've got our own local production of the kind of skills that we need. To drive NHI, you need people who understand NHI, the spirit of NHI, the ethos of NHI, the skills that are needed. And those people you'll only find if you take them into those countries, bring them back, but then you need to actually base the knowledge in the country so that you have sustainability.
So we need the human capital, we need the financial capital, Indeed. But we also need to invest in the innovation, right, Minister? Indeed. We know that money is a bit too tight to mention, especially when it comes to the state's capabilities and the strain that it has at the moment. What are we seeing from a South African government point of view in order to create an enabling environment where participants can invest in innovation in order to drive that level of sustainability?
Well, this whole notion of the fourth industrial revolution, yes. The whole area of advancement in technology has really created a lot of opportunities. So when we're looking at the national health insurance system or national health insurance, here we're looking at various innovations in terms of technology to make it easier to manage the system.
Are robots one of them, replacing doctors on a lighter note?
No, not in that way, by the way, but in the sense of a lot of software that you can actually make available to less skilled individuals who can actually transmit the basic raw data that will actually send to the central areas. So, for example, you could have someone who's running a clinic somewhere, and that's what they call telemedicine. They can take a photo yes. of a damaged eye, and then they send it to a specialist who look at it and make a diagnosis and then give you a referral direction as to what to do with that. We're looking at IT, kind of software that should be able to get someone who's with very limited training who can actually give you basic information about a particular patient, take certain very preliminary readings of the systems and the individual, like blood pressures and that kind of thing, and then feed it into the system, and the system should be able to refer you to where the patient needs to go for additional investigations and what other treatment is needed, certainly to make sure that you can screen early and then refer those who need to be referred. I was hearing here, because one of the innovations they were discussing to me was about a probe that you can put on a cell phone and scan a patient from a far off outlying area, and then someone who's more advanced in training will be able to interpret that. Now, I'm saying that there's scope for lots of innovation at that kind of level. New drugs, new interventions, all of these are things that I think are possible.
We're glad that there's scope as well as there's opportunity, but what is government doing or trying to attempt in its partnership with members in the private sector in order to accelerate this level of development and innovation on the continent?
Well, it depends on the areas. For example, on the area of medical research, there's quite a bit of partnership that we're encouraging with various private sector players who have got skills and expertise in various areas. So this morning were the whole discussions about the whole area of genomics, and in that area there are companies that have got experience in dealing with those kinds of areas. We're dealing with various innovations in testing new vaccine against HIV and AIDS, and there are companies that are actually interested in that, and working together in collaboration with government. We believe that those are possibilities, because once you deal with it, you've got a whole scope of being able to intervene on one of the major causes of morbidity and mortality, like HIV infection and so on. The new innovations that have come forth, government also embrace them, because we then consume that. One of that, for example, we've got what is called Gene Expert, and this kind of technology has been able to help us to shorten the diagnosis, the turnaround time in the diagnosis of tuberculosis. With the numbers of people that are having TB in this country, it actually helps to be able to diagnose it very quickly and deal with it, as it were. We're going to be going out there to look for an additional 2 million more people to be able to test, and treat, and so on. So innovation and technology, it's like biotechnology, various innovations are very helpful in that regard. So the whole area of therapeutic vaccine is an area that we're looking out to for various cancers and some of the infections, as I said, HIV and so on. So we're ready to partner at that kind of level.
Yes. Well, we're looking forward to those partnerships, Minister, and we will engage with some of your peers to understand exactly how we can unpack on some of those initiatives a lot more and more deeply so by addressing the fundamental issues that are faced at the ground level of many of these challenges. Something else that speaks to data as well as connectivity is obviously access to medical records. I want to gauge by the audience members, how many of you actually wear a wearable fitness device that monitors a lot of your movement or tracks your health and level of activity on a day-to-day basis? I'm one of them. Feel free to raise your hands up high. Well, that's a positive indication, because according to the recent Future Health Index, what we actually see is that there's a significantly low number of South Africans and other Pan-African participants who actually wear these wearable devices. And Minister, that segues us into the number of healthcare professionals who actually have access to digital healthcare records in South Africa particularly. For 2019, it sits at well below 40%, and we know that access to the medical records and access to understanding your heart rate at certain times of the day, how your activity actually impacts on certain healthcare levels, has a direct impact on the level and quality of healthcare that one can receive. What are we doing from a South African government point of view to ensure that we're tapping into those technologies that speak to each other in order to bring healthcare documentation and data to the fore?
I think that's more the future for us, because the issue...
How far is this future so we can prepare ourselves?
Well, no. The good thing is that there are those who are already having capacity to procure such services. They're able to use them already. So that gives us space, because it means that there's a basis on which to build from. But we will need to get to a point where the whole campaign of building national health insurance is based on keeping people well, keep them healthy. And therefore, it's a whole program on wellness that becomes important to encourage people to say, this will be good for you, and therefore you must exercise, this is the kind of diet you must encourage, and so on. And if you monitor yourself, you are able to know what the situation is with your health, so that you don't need to go to the doctor unnecessarily. You go there for specific screening and so on, but certain parameters of your systems you can actually work out on your own. That's not the only aspect of the digital innovations that we're looking at. One of the things that actually will make people feel that the system has changed in South Africa is when you actually shorten the queues at the clinics and the hospital. Yes. And one of the major problems is patient health records, where you can actually walk into a place and find that people spend 2, 3, 4 hours waiting for their records. And then now to be able to get the digitization of all the health information, so that it takes a few minutes to be able to establish that I'm a member of the NHI and that my record is available, and I go to the next site and I can get the laboratory to take the test and feed it into the system. When I walk from Limpopo and I'm in Cape Town and I'm not well, somebody can go into the system and retrieve all the latest information about the investigations and so on. That's where it will actually be really feeling the revolution. And therefore, that's one area that we need to be going towards. So it's a very big area that we need a lot of collaboration to be able to establish that kind of system.
Minister, to close off our conversation and to lead us into the follow-up that we'll have with some of your peers and colleagues within a variety of stakeholder positions, I want us to focus on partnerships. What we do see is that when it comes to the level of adoption of technology, China, Saudi Arabia, and India have proven to be front runners in this regard. Emerging markets like South Africa, densely populated like South Africa, and fiscal constraints very similarly like South Africa. What, in your view, do we need to see in order to enhance partnerships, and are we learning as a South African government from our peers and counterparts from across the globe and the continent in order to accelerate and fast-track investment in innovation and healthcare?
Well, I think, firstly, it's important to say that you need a strong partnership between government, from academic and research institutions, and industries, the private sector players, because that combination is where you are able to actually get innovation. But certainly for some of the innovation, it doesn't have a lot of immediate commercial benefits, and therefore it actually requires government policy decisions, government investment to be able to start and initiate certain developments with regards to innovation. At a certain point, it may not be so much suitable for government to fund a specific innovation that really is more for commercial development, and therefore it might require a private sector partner to come in. Mm-hmm. So a close collaboration at that level becomes very, very important. But I believe that government must always stay very close to the processes of innovation, because that way government can also select out the innovations that are much more useful and practical for purposes of being able to achieve efficacy in screening of diseases, certain early interventions, or efficient administration of other therapeutic interventions. All of that together, government needs to be very, very close to that, so that you can then make an impact on the disease burden.
As a South African government, what's the one thing you require from the private sector today?
Cooperation.
In what sense?
Well, where we've got various challenges where we believe that we need a close partnership, particularly on the areas where you've got problems such as HIV and tuberculosis, where there are interventions, where there are possibilities of breakthroughs and innovations. We'd like to collaborate and work together on those. And there will be many others, because there are quite a number of areas where we look out to say, are there potential solutions that can come in and actually make a difference. It's just that at that level, of course, a new area, a new issue will arise, because as soon as you've got some solution, what we'd like to see is lower prices. Of course, if you have invested, you might be wanting to see a lot more of your returns there. So we need to be able to collaborate and cooperate in terms of what's the best that will actually help the country, at the same time maintain your investment to be sustainable.
Collaboration, the key word that you've brought to the fore. Minister, thank you so much for your time today. We'll leave our conversation there for today as we look to gain feedback and, of course, explore even more regarding partnerships with many other stakeholders in the room today. Ladies and gentlemen, the Minister of Health in the Republic of South Africa, Minister Zweli Mkhize, who's joined us today. We're going to take a brief ad break for the moment, but when we do return, we will engage with several players within the healthcare fraternity, building up on partnerships. How do we deepen them, and how do we ensure that we tackle the opportunities to invest in innovative solutions to drive sustainability in the healthcare? Welcome back. You're still watching the CNBC Africa special in partnership with Philips, where we're taking a look at strategic investment in innovation in order to drive sustainable healthcare. You just might have missed our conversation with the Minister of Health in the Republic of South Africa, Minister Zweli Mkhize, really painting a picture as to how the South African government particularly is looking to approach enhanced partnerships with many of its stakeholders, as well as those in the private sector, in order to enhance the universal healthcare coverage as well as sustainability in this particular space. Well, we're going to engage now with multiple stakeholders, this time really focusing on how we can expand on this opportunity across the rest of the continent, making sure that this sustainable development goal is going to be reached well before the year 2030. I'd like to introduce to my left-hand side, starting with our panelists and who will continue to engage with through a question and answer session with the audience as well. Dr. Priya Agarwal, who's the Managing Director of MSD South Africa, followed by Jasper Westerink, he's the CEO of Philips Africa. Dr. Giles Van Koosten, who is a physician and medical director for Doctors Without Borders, also referred to as MSF. Peter Sands, director of the Global Fund, and Professor Pamela Naidu, CEO of the Heart and Stroke Foundation. Thank you so much to each of you for joining us. I'm looking forward to a very invigorating conversation because, as we know, healthcare is important to all of us, and many of you touch on this particular sector in a variety of opportunities, be it through financing, be it through having your boots literally strapped on the ground, or some innovative technologies that are also brought to the fore. I'd like to pick up on a theme that we touched on with the Minister of Health, which was partnerships, and he called on clear commitments regarding collaboration, which is important to ensure that we do reach a sense of universal healthcare coverage, particularly in South Africa. When it comes to each of your organizations and capitalizing on the opportunity of partnerships, how do we see that being unfolded across the African continent? Dr. Agarwal, I'd like to start with you.
Okay, thank you very much for this opportunity. So MSD for Mothers is our company's $500 million commitment to maternal health. And people say, well, why is that a strategic investment in healthcare? It's because we know that if your system cannot keep women alive during pregnancy and childbirth, it basically means your healthcare system is not functioning. So that's why we decided to invest in maternal health. Now, we've learned 8 years into this $500 million initiative that we cannot succeed and sustain healthcare improvement without partnerships. So Senegal is one of our examples, supply chain innovation. They were having stockouts over 90% of contraceptives. We reduced that to less than 2% in 2 years, but that was by having really good partnership with the government, an NGO, academia, as well as ourselves to bring the supply chain innovation to the fore. And so we've seen this in multiple countries. So I was really glad to hear that the Minister of Health believes that even for the NHI, we are going to need private sector, government and civil society at the table. The other thing that we found beyond sort of the importance of innovation and partnerships is actually sustainability is really hard.
Yes.
So we talk about it a lot. It's a great buzzword, but actually ensuring healthcare improvements sustain beyond donor funding, external financing, that's what's actually the crux and what our focus is right now. So our most recent partnership is actually with OPIC, as well as USAID and Credit Suisse. And actually what we're doing here is unleashing private capital and new players and bringing them into the to the table. So there's a lot of innovators out there and a lot of entrepreneurs, but they're either too small, so they affect a little pilot, it's great, or you've got the big MNCs. Well, how do you get good innovations to scale? And what's been very interesting is we have got $50 million as part of this partnership. And Merck for Mothers, MSD for Mothers comes in to de-risk some of those. And we're finding it very hard to find investable enterprises. And so I don't know whether we're sitting in an echo chamber of all the usual suspects, but as we're on TV, I'd like to put out there that we have this resource that we would like to use to help those small enterprises, de-risk them, and enable them to scale.
We're going to come back to that in just a moment because I do understand that capital is quite critical. And Peter, you'll also join us in for that conversation. But on that element of deepening these collaborative efforts, and as you say, getting all the parties and stakeholders at the same table, but how do we ensure that it cuts across the variety of segments? Jasper, I'd like to get your view as well. Dr. Van Koostem, feel free to jump in here, especially given that you represent such different perspectives of healthcare. But how do we deepen these collaborations, and how have you done that within your respective organizations to ensure that access, communication, and collaboration is attained?
Well, I think if we see it in the context of the fourth industrial revolution, we also need to realize that basically healthcare is completely changing. And I think as a private company, our goal is, of course, to make a positive impact into people's lives, but it's also a business we run. So we're actually at crossroads on to think about how the new business models to provide healthcare at a low cost, good outcomes, how that's going to take place. And I think the only way to do that is actually by building partnerships. So across Africa, we are building partnerships with NGOs, with governments, aimed, for instance, in Kenya, in driving primary care. How do you make this accessible? How do you scale this? In Ethiopia, where we're building a cardiac center. So I think to me it's very much driven not only from the need to offer healthcare to everybody, but also with this fourth industrial revolution, I think the business will completely change. And the only way to do this is to partner up and to find together these new business models that can bring a sustainable business and have a very large impact in healthcare.
And making sure that the products that you innovate and develop actually speak to what Dr. Van Koostem is facing on the ground.
Yes.
Absolutely. So first of all, we're calling for a needs-based innovation, and the commercial interests, as the minister said, are not always the same as the needs on the ground, and so research and development should be geared towards needs. But then I'd like to bring in a partnership that hasn't been mentioned yet. It's the communities. And so last time I saw the minister was in a show in KwaZulu-Natal at the launch of the global UNAIDS report called Communities at the Center, where MSF in partnership with the Ministry of Health showed that it's possible to test, treat and suppress HIV at the levels of the UNAIDS targets if you engage very closely and work with the community. So the community is not just they are not just your clients, but they are also a resource you need to engage with in terms of needs. And examples of that are adherence clubs for ARVs, where people are taking their ARVs in groups that are entirely community managed. Testing in the community by lay health workers, or these very fancy new diagnostics that we talk about, like strips to detect opportunistic infections such as cryptococcal meningitis, or TB, the urinary TB LAM, a urinary test for TB. Well, they can be performed by cadres with a very low level of training. They could even be, so invest into task shifting and task sharing towards lower cadres of healthcare is very important.
Exactly.
Yeah.
Professor Naidu, I'd like to come to you to also get your perspective and building up on the theme that's been highlighted regarding a sense of community and their involvement and participation. So often when it comes to integration, public-private partnerships, as well as conversations which include collaboration, there's always a sense of layers, right? And a hierarchy that needs to be involved. How do we make sure that the messaging that is on the ground, that speaks even to an environment and sector that you take care of, being preventative healthcare solutions, actually gets to the levels that it needs to be heard at to ensure that the development of these solutions is all-round and encompassing?
Yeah, thank you for that. So that's a really great question, because I think that just from a philosophical point of view, and non-profits cannot function without private-public partnerships. There's absolutely no way. I mean, I head up the Heart and Stroke Foundation South Africa. I'm the president of the African Heart Network, and trust me, across Africa, there isn't dedicated funding for primordial or primary and secondary prevention in the work that we do. So I think a wonderful example, since Philips is one of your key hosts today, is we've just had a wonderful private-public partnership with Philips, and it's really about going from the bottom up and from the top down. So I think that if you place all of this in a human rights context, so technology is wonderful, particularly around prevention, know your numbers. So we're constantly telling people out there, well, you need to know whether you're hypertensive or not, or you need to know your cholesterol levels and so on. So I think the technology is one thing, and we should make it accessible to more people than fewer people. But I think there's a key, we have to locate it in an empowerment model. So I think, yes, I hear you, Gilles, because, I think we really need to get the technology down to the ground. But I think the key thing is, can they uptake this? Is it appropriate for the community? And so from my perspective, a lot more needs to happen. It has to be a multi-sectoral approach. I think we cannot ignore the fiscal. So like taxation, sugar-sweetened beverage tax, tobacco taxes. Are we investing that back into the organizations that are actually doing the work on the ground at a community level? So yes, I do believe there's wonderful opportunities for private-public partnerships, but I think that we have to frame it in a way that pins us down, and that we obliged to provide care to our people in the country and on the continent.
Peter, I'm tempted to look at you and say, show me the money, because that's where it goes back to, right? And given the organization that you represent. But we've heard Dr. Agarwal talking about the access to capital, which is required fundamentally. We've heard as well Professor Naidu referring to the fact that sometimes it does need additional financial assistance and support. In your experience, though, in order to deepen these partnerships, does the conversation need to start with money? Or perhaps is that where often the waters get muddied, that we're not facing the issues on the ground in addressing the healthcare needs of ordinary citizens?
I actually think the conversation needs to start with what we're trying to achieve.
Yes.
Whose lives are we trying to save? Whose families, which communities? How are we actually trying to make life better, healthier for people? The Global Fund, although it is about money, is actually an extraordinary example of partnership. Right from the start, it was created as a partnership between donor governments, implementer governments, between civil society, between the private sector. And unlike many such organizations where there are advisory boards and things, all these parties are actually on the board of the Global Fund with voting power and direct involvement in decision making. So it's a pretty unique example of how you can create quite a powerful partnership in global health. Now, the Global Fund to Fight AIDS, TB, and Malaria deploys about $4 billion a year in fighting the three diseases and accelerating progress towards the SDG 3 goals, which makes us probably the largest multilateral provider of external assistance in the world. But that's not enough. And coming to the money question, we do have to get very realistic about the money. To achieve the objectives that we all have and that countries are committed to in SDG 3 will take a lot of money. Some of that can come from outside, and that's why things like the Global Fund's replenishment, which takes place in October, where we're targeting to raise at least $14 billion, are so important. And that's more. We're asking for 15% more. Because without that money, we are not going to achieve the kind of pace of change and improvement that we need. But also, a lot of it, the big change has to be in what countries themselves do. And that's why I think the minister is absolutely right about the fact that a country like South Africa cannot afford not to push ahead with plans for universal NHI schemes, because that sustainable structural funding solution in the long run is the answer to building universal health coverage. We can help in the short term, and we can help particularly with the poorest and most vulnerable, but the long-term solution are structural, systemic solutions in the countries themselves.
Yeah. It almost does seem as though we do need this multi-pronged approach to ensure that the structural issues also are taken into account. But I do want to go back slightly to a comment that was made by you, Dr. Agarwal, and perhaps it's a twofold question in this regard, making sure that, yes, the capital is available, but yet we're not finding the projects that are investable or bankable on the ground to actually meet the healthcare needs that we require. And at the same time, are we ensuring that even though there is capital available, that the needs on the ground are fully understood and there's a comprehension there? Is there a solution to the challenge that you face, and maybe a solution that can be shared by some of your panelists here?
I just think, going back to what you said, where we start with the needs and we have to engage civil society, the advantage of these small and medium-sized enterprises and the entrepreneurs are they are directly responsive to civil society's needs. They are coming from the ground up, right? They're seeing the problem, they're innovating around the problem. You have this concept of frugal innovation, right? So it's not someone in New York saying, oh, I think South Africa needs this. No, it's a South African entrepreneur who is saying, I'm having this problem, I've created this. They might get some seed funding, donor funding for a little bit, and then it stops, right? So how do you then invest? How do you find them? And then how do you invest to make sure these now entrepreneurs who have addressed their local needs then are able to scale to the point where someone like our Minister of Health can say, you know what, actually, now I want to support an enabling environment for you to scale. Yes. And I said support an enabling environment because it's not about financing at that stage. Because if you can get this entrepreneur to a medium-sized enterprise, it creates a market, right? And so that's why these market-based solutions are so important to support, because we can't keep relying on donor funding and that, you know, the NHI in South Africa is going to fund everything at scale. And so that's what that's why I think these entrepreneurs and a lot of, professors at Harvard Business School, et cetera, will say, if you look at the history of sort of countries that have come out of poverty, right, they have created an environment to allow entrepreneurs to succeed. Look at Kenya, yes, right? And so I think that's really critical. And as we think about South Africa, we have to all support that environment for these market-based innovations to scale.
And opening it up across the continent as well. And I think both Philips and MSD have obviously shown that they've participated in this, a clear understanding of what it is that civil society needs. But Dr. Van Koostem, do you have any suggestions as to how we can ensure that there's, again, that clear communication in building up on these investable projects? How do we find them? How do we create them as well?
Well, to me, you have to start with a needs-based analysis. And there you have to look at public health, burden of disease priorities, not just who are we trying to treat, but what are the main killing diseases, and use these very strong data, and that needs government and academic leadership to tell where the innovation is needed. And so that's a mix in terms of partnership between government, academia, and on the ground level, where you actually see the problems arising. And I'd like to add one thing that's a little bit different, but it's on the issue of domestic funding that Peter hinted towards. That is definitely a shift from international funding towards domestic funding is possible in countries like South Africa, but that shift at the moment is not going to happen quickly in very poor countries such as Malawi or what we see in West and Central Africa, and an unrealistic push to very poor countries to start taking up the entire burden of funding healthcare themselves. That is a lack of not social solidarity, but of global solidarity, and so we would like to tamper the push towards domestic.
Can I just add to Gilles' point? I mean, I completely agree on that point, and indeed, I think international funding to support the healthcare of the people in the poorest places, the people who are most vulnerable, needs to step up, not reduce. At the same time as we are encouraging countries that can afford to finance more of their own to do more. Can I also pick up on your earlier point about communities and the importance of listening to communities? And indeed, we have affected communities represented on the board of the Global Fund. I think this is really critical because even people in the same country may think they're listening to the people who are affected, but actually they're not. I've been very struck by the fact that one of the critical challenges in fighting HIV at the moment are the rates of infection among adolescent girls and young women in Eastern and Southern Africa in particular, which are often a multiple of the rates for boys of the equivalent age. Lots of people have lots of ideas about what to do to help these young women protect themselves. It's not always so obvious that people are actually listening to what the young women themselves are saying.
Yes.
And so actually, as a good example of a partnership, we've actually worked with a number of private sector partners, Viv Healthcare, Unilever, others, who have actually worked with us to fund something called Her Voices, which is basically a little fund that gives very small grants to groups of adolescent girls and young women so that they can turn up at the meetings, so that they can actually have the bus fare to get to the meeting that is all about the program that is meant to affect them, and so that they can have their voice heard. And so I don't think it's enough we can't just be sort of passive about getting the voices of affected communities heard. We need to actually proactively empower them to be there, make their points. And lots of it's really, I remember one very simple thing. This girl from a school saying, very practical problem. She says, if the clinic closes at the same time as school closes, then I have to get an excuse to get out of class. And because of the stigma and things, I don't want to do that.
Exactly.
I mean, innovation doesn't have to be the latest sort of biotech. Innovation can be simple times like opening hours of clinics.
And understanding the social dynamics there. Dr. Agarwal, you wanted to add something before we do jump to the theme of technology as well?
I just think what he mentioned around sort of the needs-based is really important. And one sort of request I would put out there is we all talk about HIV and Global Fund, funds HIV, and we have this conversation outside in the room saying, why are there no rapid diagnostics for Africa that are cheap and affordable? We're not a diagnostics company, but actually, if you look at their business model, we don't have good data on HIV in this continent. Now, if you don't have good incidence data, then how are you expecting a company to be able to go, well, this is the market opportunity, and be able to convince the decision makers that we should invest in this rapid diagnostic? So, you think of Europe and you think of China and you think of America, these big populations. We have to remember that the challenge with Africa is it's 50-something countries, right? Or we say, no, it's one continent, 1.2 billion people. There is a huge market opportunity here, but then we need partnerships to say we will get you the data to support your commercial business model, right? Whether it's surveillance of antimicrobial resistance, whether it's HIV incidence, whatever's important for the continent. So I think that's where a really important partnership exists. Support these companies to make affordable, accessible technologies by investing in getting good data so they understand the market.
Understanding the social elements, good data as well. You want to add, Professor Naidu?
Yeah, I just want to quickly say, I think the one thing that we're not spelling out very clearly is the fact that in healthcare, or any health issue, it has to be evidence-based. So I love the idea of the funding and all of that, but I think the question to ask is, how do we equitably distribute these funds to the right entrepreneurs? And really, to take it to scale, and I'm sure the Minister will agree with this, is really that's what NHI is about. It's really about placing this in a public health context. So what types of innovations do we want to fund?
Yes.
Based on data and evidence.
Exactly. It's a burden of disease. So how do we actually then prioritize and as we say in healthcare, is priority setting?
And that's a solid base to segue into another theme that has fundamentally brought us here today, which is the element of technology. And of course, us using new tools and this digital age to actually reach the needs that are required on the ground. I'm here already thinking of some of the Philips innovations that have come to the fore to address maternal and mother and healthcare needs, such as Visic or Lumify, which is basically a mobile I forgot the word, ultrasound. Maybe because I haven't had children yet, but you're quite right, ultrasound, which is required across rural areas across the continent. And I wanted us to go back to that, Jasper, that these are innovations which are speaking to the African continent. We're trying to cultivate an environment of innovation which comes and sources solutions from the continent for the continent. But how do we make sure that as we move and evolve with this world of technology, that we adopt the technology quick enough, but at the same time adapt? Because it's an ever-evolving world, and new innovations come out constantly, requiring more capital, requiring more human development skills, requiring more entrepreneurship. From a Philips point of view, how are we making sure that we use technology as a panacea, but constantly adopt and evolve as well?
Well, I'm not sure if it's always more, because you can also have technology that actually reduces cost or shifts tasks. So I think the main challenge is, because everybody is saying the same, you want to make an impact, you want to scale it, and it needs to be sustainable. So one of the ways we look at it is actually looking at what we call value-based care. Because any innovation you could actually test on a number of elements. Is this driving higher satisfaction and curing of the patient? Is this making the work and the life of the healthcare professional better? Is it driving better outcomes, fact-based? And is that lower cost? So I think it's very difficult now to say what innovation is going to do and how it's going to look like, because it's going to change tremendously. But if you use these 4 cornerstones to test what you want to do, you at least know you're driving a value-based cost drive towards a better solution. I think what is going to be extremely interesting is how the regulatory framework is going to deal with it.
Yes.
Because the example of the ultrasound is a pilot we did where we actually trained people that were not healthcare workers to do a scan. And they could go into rural areas where you don't have a radiologist or you don't have a nurse. This is a clear example of task shifting, and with that, of course, you can imagine the whole regulatory discussion pops up. The outcomes were very positive. How do we now translate that, again in partnerships with the government, into also changing the rules and regulations on who can perform what and at what cost?
Yeah. That raises the very critical point that was also alluded to earlier. Dr. Van Toestem, sorry, I think you wanted to add to that before we come to sustainability.
Well, to answer to that, so you can actually preempt that question by doing research that proves that you can safely do, for example, ultrasound by lay health staff. If we look at HIV testing, the rapid test, it took many, many years for lay health workers to be approved to do HIV testing in South Africa. This could have probably been solved if you had a very strong studies, basically providing that evidence in advance so that the regulator cannot do anything else than say, yes, okay, lay health workers can do HIV testing, as is now the case, but it took 10 years. Yeah. So, but industry can preempt that by from the beginning doing that providing that type of data.
Yeah. Very critical that you mentioned that, and that's the reason why we're having these conversations, so that these exchanges can take place very practically. I'm told we have 1.5 minutes for this panel left, so clearly time goes by when you're having fun. And I want us to leave it off on a solid note where we have a call to action. Sustainability is what we're trying to drive. We've discussed the innovation. We understand it requires investment in the form of capital, human development, and of course, ongoing collaboration. But what is the one element that each of you require from other stakeholders in order to ensure that we can drive sustainability? Not just government, but other participants that you would like them to commit to particular projects or commitments in order to drive sustainability. Let's start with yourself, Professor Naidu, as we make our way down the panel. 30 seconds maximum each.
Sure. So I think just to kind of consider what the direct and indirect contributions to improving the healthcare system in South Africa. And for me, I think it's infrastructure. And so that's, I think, where the collaborative partnerships can come in and addressing the structural issues in the country. So to have a community voice, yeah.
Peter?
Mine's very simple. I have to raise $14 billion by the 10th of October. My ability to support countries like South Africa is a function of how much I raise. And actually, I'm delighted that later today we have a number of companies that are going to be actually announcing pledges as part of that replenishment. So we're making good progress, but I need that $14 billion.
A lot of money there. Dr. Van Koosten?
Yeah, openness and flexibility. Because when we engage in partnerships, often we are faced with extreme rigidity of certain partners, and that makes collaborations difficult. With a little bit more openness and flexibility at all the levels, I think we can work better together. And then inclusiveness, because certain groups in society are completely neglected, and I'm talking about, for example, sex workers or men who have sex with men. They do play critical roles in healthcare, and making sure that you include them into the discussion is very important, so that you can gear your services towards them.
Jasper and Dr. Agrawal, very briefly.
To me, I think it's curiosity and willingness. I think with the technology today, we know the world is going to change. There needs to be curiosity to look at what this can offer, how you can actually drive better service at a lower cost, and then a willingness to basically change. Maybe our company will in 5 years look completely different than we do now. Maybe the government will provide healthcare better. So curiosity and willingness to change.
I have one request and one offer. So my request is, as we bring innovations, especially to the government, can we have an innovative mindset to partnership? Like, how can you enable us to bring our innovations to the people faster, quicker, more nimbler? My offer is we have $50 million on the table for small and medium-sized enterprises. There should be some focus on maternal health care, but that is really about health system strengthening. So if you're interested, let me know, or go to msdformothers.com. But please, please, if your impact is on healthcare, you believe in sustainability, there is money on the table.
Expect your call to be ringing off the hook recently. Thank you so much to our panelists for joining us and sharing some of their insight. A lot more that we could explore, but of course, due to time constraints, unfortunately, we've given you some seeds to think about and consider. But of course, action is also what we need following this conversation. A big thank you to all my panelists for having joined us today for a conversation into sustainable and innovative solutions that we're trying to drive in the healthcare fraternity. It's been an absolute pleasure having you watch us there at home, and of course, your feedback on social media. Keep using the hashtag Future Health and keep your participation here at the CNBC Africa Exchange. We're going to say goodbye to our television viewers and thank our audience as well for participating. So again, to you at home for having joined us. Until next time, we say goodbye.